Hi, I'm Bertha, and this is week 8 presentation. So before I start any MRI, I am going to look at my inquisition, and I'm going to make sure that I have all the information I needed in order to do my exam. So I'm going to make sure I have the patient's information, the type of exam I'm going to do, diagnose protocol, physician's information, and signature. Once I have done that, then I'm going to go ahead and demagnetize, and I'm going to make sure I have my watch is off, my cell phone is not on me, I don't have my keys on me, I have no jewelry on me, my badge is not magnetic, and I'm just going to make sure I have nothing ferrous on me before I enter zone 4, the scanning room. Once I do that, I'm going to enter the scan room, and I'm going to place gloves on to sanitize the scanning bed, the coil I'm going to be using, the emergency squeeze ball, and the headphones. I'm also going to lower the table low for the patient to easily get on the scanning bed and place um, clean linen. So I'm going to make sure I do that for before I start any exam. So that includes for the and all the type of exams I'm going to be talking about today. So once I've done that, I'm going to go ahead and uh, start my exam. So when my patient comes into the scan room for the cervical sagittal sequence, I'm basically going to grab my phased array coil or CTL coil, and I'm also going to use a bridge coil over the neck for the phased array, and then my landmark is going to be 2 inches below the chin, so mid neck. And I'm going to make sure my patient's lying down supine head and first for the scanner. So I'm going to do that. So when I run my cervical spine sequence, I am going to angle parallel to the spinal cord, and my size coverage is going to be from the transverse process to the transverse process. My field of view needs to cover the entire cervical spine, all the way down from the pons to T4. And I'm going to place a band over the esophagus to avoid any swallowing artifacts from the patient. And I'm also going to make sure I tell the patient to hold still as much as possible. For the cervical axial scan, we are going to plan my axial on my sagittal plane, and then I'm going to angle perpendicular to the spinal cord, and my size coverage is going to be from C2 to T1. And for the coronal sequences, those are usually optional, and usually it's only done for patients with scoliosis. When we do the thoracic spine sequence, we're going to use the phased array coil, and then the patient will be lying down supine head first, and we're going to go ahead and landmark 2 inches below the neck, so mid neck, or 2 inches below the chin, so mid neck. And if we're not using a localizer, then our landmark is going to be on the sternum. For thoracic sagittal sequence, we use a log sequence that basically is to find the exact vertebrae. So the angulation is so we angle parallel to the spinal column for our sagittal sequence, and then our field of view will include C2, and it'll go all the way down to T7. And it records the distance between each vertebrae. For a thoracic sagittal sequence, we're gonna plan our sagittal on the coronal image plane, and then we're gonna angle parallel to the spinal cord. Our field of view will be it's going to cover from C1 to T12. And our slice coverage is going to be from the transverse process to the transverse process. We're also going to place a a set band to it's going to go over. It's going to be placed over the chest on the sagittal plane to avoid breathing artifact. For the thoracic spinal axial, we're going to place that on our sagittal plane, and then we're going to angle perpendicular to the spinal cord. Then the slice coverage is going to be from T1 to T12. And we're also going to place a saturation band to avoid any artifact from breathing from the patient. And for the coronal plane, it's again only optional if we're looking for sclerosis. And for our lumbar exam, we're going to use the phase array coil, and then we're going to have the patient lie down, supine head first. And the landmark for that is going to be on the iliac crest. So for the lumbar spine sagittal sequence, we're going to angle parallel with the spinal column, and our slice coverage is going to be through the vertebral bodies and facet joints on both sides. And then our field of view is going to include the T11 to S3, so the entire L spine. And for the lumbar axial sequence, the multi-slice ones, we're going to angle with the spinal column, and we're going to include the vertebral bodies and intervertebral discs. And we're also going to place a block of slices over the area of interest. For that, we're going to angle with the spinal column and split the difference of the natural lumbar lordosis. And for the lumbar coronal, again, that one's only used for patients with scoliosis.